Well, thanks, Dave. And the kids are headed back to school in less than a month. But before they settle into the classroom, getting their vision checked is vital to helping them do well all year long.
Joining us now with more, welcome East Cooper Medical Center's ophthalmologist, Dr. Prat Itharat. Thank you for joining us.
Glad to be here again.
Now, we are pretty close, unfortunate for the kids, we are pretty close to going back to school here. Now, you know, younger kids, I have a 3.5-year-old, and it's hard sometimes for them to communicate how they're feeling, especially when it comes to their eyesight. What should parents look for when it comes to vision for their children?
Right, I think I'm a parent as well, and I think like most parents, we want our kids to succeed and excel in school. And vision and eye health is important in a child's ability to perform well in the classroom, in the playground, in sports, and as well at home. A few signs patients should look, or parents should look out for is first, ocular or behavioral health of their child, whether the child seems to be seeing well or whether they have to hold objects too close to their eyes. Parents should also look at the appearance of the eye. So if the eyes look abnormal, the eye sometimes can turn inwards or outwards, what so-called lazy eye. If the eye has a cloudy appearance to it, or if it has an abnormal growth or a droopy eyelid, those are worrisome signs, especially in children. Finally, it's important to ascertain whether children have had a previous history of trauma to the eyes, because that can affect vision as well.
Well, sometimes, you know, I was always told by my mom, don't sit too close to the television, it'll hurt your eyes, you know, things like that. And kids always do those things. Is it possible that if they do have eye issues, if they go untreated, then it could get worse over time?
It definitely can get worse. So most of us, I think, know of someone with a lazy eye, and someone with a lazy eye, if you ask them how their eye compares or how they see compared to the other side, they'll say that they can't see quite as well out of that lazy eye. And what happens when we're younger, between the age of, let's say, 0 and 12 or 13, is that the eye forms connections with the back of the brain. So if that eye doesn't see well for some reason, if it's turned out, or if there's a cataract or a cloudy cornea in the front of the eye, those connections never form completely. And so in adulthood, the visual potential in that eye will never be as good as the other eye.
Now, my wife and I both, later in life, we had vision problems. Is this something that's hereditary, that if both parents or maybe one parent, you know, had, you know, vision problems, is that something that maybe the child will get? Is there a higher percentage of that happening?
We do find that if parents are very nearsighted or very farsighted, some of that is inherited, but some conditions can be not inherited as well in kids. I would say about 2 to 4% of children need some type of treatment for an eye condition. Okay. Usually the most common condition is nearsightedness. For treatment, it may be something as simple as glasses, or it may be something more complex as bifocal glasses, eye patching, or even eye muscle surgery if the eye tends to deviate inwards or outwards.
For younger children, do you see being proactive being a better idea than just waiting for these symptoms? Possibly, maybe at a certain age, you just get them screened every year?
Right, children, especially young children, cannot communicate their need or their blurred vision or their problems with their vision, so it's important to get them screened. The screening exam should be included in their normal physical examinations at birth, and again between 6 and 12 months of age, and finally at 3 to 3.5 years of age by a pediatrician, a family care doctor, or other healthcare professional. If there's an abnormality noted on that exam, they are then referred to an eye care specialist for a full eye examination.
Now, if detected early enough, is it easy to reverse the vision loss? I mean, as the years go on, so maybe in their adulthood and later we can correct this?
Right, there are certainly some conditions that are more worrisome, but they can be minimized with early intervention, particularly you know, kids with a lazy eye or an eye that turns out, or an eye that needs a strong glasses prescription. Wearing glasses or patching the good eye to strengthen the bad eye can improve the final visual potential in that bad eye. Okay,
real quick, yeah, how can we get a referral to, you know, get screened, or our children get screened, if this is something that may become a concern for some parents out there?
Usually your pediatrician or family care doctor will refer your child to an eye care specialist if there is a problem with their exam. If the parent's concerned because of the signs mentioned before, you can make an appointment directly with one of your local optometrists or ophthalmologists, and they should be able to diagnose the problem.
And then come check you out as well too, right?
Right.
All right, sounds good.
Thank you so much, Dr. Itharat, for being with us today. We appreciate it.
Thanks for having me.
All right.
Thank you. Well, back to school includes school lunches. How do you keep your kid from trading away the food you give them at the lunch table? One Hollywood actress and mom says she has the answer. That and more coming up on Low Country Live.